How to identify the Dvandvaja dosha prakopa nidana? How to identify the etiological factors that increase Vata and Pitta at a particular time period? This is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the Nidana of Vata Pittaja diseases, there is no specific description available in any of the textbooks, but it is being said that the Dvandvaja dosha prakopa that will be taking place because of the mixture of the consumption of these etiological factors. In other words, Vata etiological factors as well as Pitta etiological factors. It is being mentioned Dvandvam tu Sankarat. So that is, if the person is going to consume the etiological factors, that will be responsible for the abnormal vitiation of Vata as well as Pitta. There will be the vitiation of or the manifestation of Vata Pitta dominated disease that is going to take place. It is being mentioned in Ashtanga Hridaya, that is Tiktoshana Kashayalpa Ruksha Pramita Bhojanaihi Dharanodीर्ण दिशा जागरात्युच्च भाषणैः क्रियातियोग भीशोका चिंता व्यायाम मैथुनैः ग्रीष्माहोरात्रिभुक्तान्ते प्रकुप्यन्ति समीरणः. So these are the etiological factors that are considered to be responsible for abnormal increase of Vata dosha. Pittam katvam latikshnoshta patukroda vidahi sharan madhyanna ratri artha vidaha samayeshu cha. These are the etiological factors that are responsible for the abnormal increase of Pitta dosha. When you think about the Vata dominant etiological factors as well as Pitta dominant etiological factors. So these are the list of Vata dominant etiological factors, and these are the list of Pitta dominant etiological factors. If an individual is having exposure to any one, two, or three related to Vata increasing Nidana, and he is simultaneously having an exposure to one, two, or three or more etiological factors related to Pitta dominant etiological factor, then the person may develop the Vata Pitta dominant disease. For example, if the person is having the Vegadharana, in the sense the constipation, and he is consuming the Pitta dominant Nidana, for example, Ushna Ahara or Lavana Rasayukta Ahara or Tikshna Ahara, for example, Gobi Manchurian, etc. In that particular situation, we are going to have the abnormal increase of Vata as well as Pitta. If the person is going to consume the food substances during the state of Chinta, that is absolute stress, mental stress, so that will be considered to be responsible for the increase of the Vata, and he is consuming the samosa as such, that will be responsible for the abnormal increase of Pitta in that way. So any one, two or more Nidanas pertaining to Vata increase spectrum, and any one, two or more related to Pitta increasing spectrum of the etiological factors, then the person will be developing the Vata Pitta dominated disease. So here we are going to learn about these with a few examples. Before that, the key factors in identifying the assessment of Nidana, so that is considered to be mainly the three. That is what we can say SNV of pathogen. That is, S refers to the source of entry of pathogen in the natural orifice. Whether is it in the one orifice or two orifice or three or more orifices, so that is going to decide the Nidana aspect. Second one, that is the number of pathogens entering into the body. Less number of pathogens, less severe form of the disease. More number of the pathogens, more severe form of the disease. Third aspect, that is virulence of the pathogens entering into the body. Virulence in the sense, less number, more virulent, more severe form of the disease. Less virulent, more number, less serious form of the disease. In that way, so this three key factors which are essential in identifying the assessment of Nidana, that is SNP, source, number, and virulence. Regarding the examples there, here the lady who is doing the occupation of preparing the samosa, the 40-year-old lady preparing the samosa, and that too she is going to prepare the samosa at around 6 o'clock to 7 o'clock in the evening time. Definitely that is the time period where we are going to have the natural increase of Vata dosha there, and she is going to prepare in the fire, in the sense that will be associated with the Ushna Guna exposure to the body. So that is responsible for the abnormal increase of Pitta in the Vaja region. And during the preparation, she is going to consume the 1 or 2 pieces of samosa. Then again, so this will be considered to be having the, for example, so here the probable ingredients: potato is of 50%, chili is of 2%, salt is of 5%, lemon is of 1%. In that particular situation, there will be the Vata as well as Pitta dosha increase that is going to take place in the alimentary canal. And further, if she is being preparing the samosa in mustard oil, again this is considered to be the Pitta dominant etiological factor there. In that particular situation, the person may be having the, or the, in this lady, she may have the Pitta dominant disease more than Vata dominance. Or the next point, that is whether reheating of the mustard oil is being done or not. That's again the, what we can say, the Vidahi Ahara as such. In that particular situation, the lady may be developing the abnormal increase of the Pitta dosha, specifically in the Mahasrotas at the beginning. Then, during the preparation, the skin will be exposed to the heat. In that particular situation, even the twak may be afflicted to Pitta dosha increase. In that way, so we are going to expect the abnormal increase of Pitta as well as Vata in this particular situation. Let us take one more example. A 27-year-old male consuming samosa at around early morning, at around 6 o'clock in the morning. So the probable ingredients we may suspect: potato 45%, chili 3%, salt 7%, lemon 2%, etc. Along with that, he is going to consume with the green chutney with salt 10% and still chili 10%. In that particular situation, we are going to expect the abnormal increase of Pitta and Vata in the alimentary canal, because the source of the entry of the pathogen is oral cavity, and he is consuming up to 5 samosa or so. In that particular situation, we are going to have the number of pathogens which are considered to be responsible for the Pitta dosha increase is more. Hence, there will be the abnormal Pitta increase will be seen in the alimentary canal. Next example, let us say a lady, 25-year-old lady, she's doing the cycling at around 12 p.m. and she is going to cover 10 kilometers. At that particular time period, the lady may be developing the thirst as such, which indicates dehydration. During that particular time period, she is drinking the water of 1 liter of water at a particular time period. So in this particular situation, we are going to expect the Vata increase, that too in the muscles, wherein we are going to observe the Chalaguna increase there, and blood vessels, we are going to observe the normal increase of Vata dosha, which is again indicative of increased pulse rate, etc. Chalaguna increase, and Pitta dosha increase may be suspected in the skin, which is pertaining to the, what do you say, that the profuse sweating. So because she is doing the cycling at around in the mid-noon, that too in the summer season, etc. So we are going to suspect the abnormal increase of Pitta dosha. So here Vata as well as Pitta dosha increase will be observed. Another example, the person is having the diarrhea and he is going to consume again the samosa. In that particular situation, abnormal increase of Vata dosha is going to take place in the alimentary canal. But here it is not only related to the simple Vata, it is the Chala guna of the Vata will be observed in the alimentary canal, and the abnormal increase of the Pitta, that is Ushna, Tikshna, etc. of the Pitta dosha will be observed to be increased in the alimentary canal. Vegadharana. Another example. So here, abnormal increase of the Vata dosha is going to take place in the alimentary canal, and abnormal increase of Pitta dosha is going to take place in the alimentary canal. But here, it is the not the Chala guna increase, it is the Ruksha guna that is going to get increased in the alimentary canal, which will be deciding the abnormal increase of the Vata dosha. So here, in this particular situation, we are going to expect the Vata as well as Pitta dosha increase in the alimentary canal. Another example, so here, Ratri Jagarana, while watching the movies, consuming the samosa there. So here, plenty of samosa are being made, shown here. And here, we are going to expect the abnormal increase of Vata as well as Pitta dosha increase. So after seeing this, how to identify the Nidana in a particular individual? So for that, you need to identify the abnormal patterns. What kind of the patterns a person is going to follow? Whether he is going to consume the samosa throughout the day, only samosa throughout the day, 3 or 4 times a day, or whether the person is going to consume samosa along with the what do you say that the tea or coffee, etc. Whether he is going to consume the samosa along with the what do you say that the pakoda, etc. That is going to decide the what do you say that the abnormal patterns or what particular type of the activity the person is doing. Whether the person is going to suppress the natural urges, for example, the vomiting or diarrhea, etc., or whether the person is suppressing the urge of the defecation, etc. So that is indicative of the abnormal increase of the Vata dosha there. Consumption of samosa, that is abnormal increase of Pitta as well as Vata dosha. We are going to see that. For that, we have to follow the what is the timing of manifestation of symptom. At what time the person is developing the symptom, that has to be known. And you have to know about the chronology of the development of the symptoms has to be recorded. And one has to do the SNV of pathogen analysis. That is source, number, and virulence of the pathogen analysis has to be done. And based on that, we have to identify the dosha vitiation, which can be attributable to the symptom development. In this way, we have to analyze the each and every Nidana individually and specifically. Hence, the identifying the Nidana, specifically in case of Dvandvaja Vikara, is posing a major challenge because of the varied, what do you say, that the exposure to Nidana, varied exposure to different degrees of etiological factors, and varied, what do you say, that the body response by an individual towards these etiological factors. Hence, to sum up, SNV of pathogen entry into the body, that should be recorded in each and every history taking. S refers to source of the entry of the pathogen, N refers to number of the pathogens, and V refers to virulence of pathogens entering into the body. In either any one, two, or more etiological factors related to Vata Prakopa, or any one or two or more etiological factors related to Pitta Prakopa exposures will be seen in an individual simultaneously. Hence, the situation of an individual during the exposure of the Nidana that plays a major role in the vitiation of Dvandvada dosha prakopa, that too specifically in cases of Vata Pitta dosha vitiation in this particular scenario. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that I like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Something more in the next video. Thank you.